Great, thank you. Well, good afternoon, everyone, and welcome to Trust for America's Health's Age-Friendly Public Health Systems training for the month of December, our last one of the year. We're so happy that you're here with us this afternoon to learn more about how the public health sector can partner with other sectors. And today we'll be talking about dementia-friendly congregations and faith-based communities and partnering across the age-friendly ecosystem. My name is Megan Wolf, and I'm joined today by my colleague, Dr. Karan Phillips. And the AFPHS, or Age-Friendly Public Health Systems movement, would not be possible without the generous support from and partnership with the John A. Hartford Foundation. We're very thankful to our partners there. Next slide, please. So we ask that you please keep your devices muted during the presentation today so we can avoid any background noise, but do feel free to put your questions in the chat throughout the presentation today, and hopefully we'll have some time at the end for a nice Q&A session. Next slide, please. All of our AFPHS trainings are recorded, and the slide deck will be shared with anyone who is registered after the training. If you are using an AI note-taking tool, we would appreciate if you would let us know by commenting in the chat before our speaker begins. In addition, you must be present in the training with the AI note-taking tool. Notes generated from any AI tool can only be used for personal use. Next slide. Your feedback is very valuable to us, so we'd appreciate if you would take a few moments after today's session to complete this feedback survey that will just pop up automatically on your screen at the end of the training. Your insights are really helpful to us. We will be sharing them with our evaluation partners at the New York Academy of Medicine, and they'll just help us to enhance future trainings. Next slide, please. So as most of you know, Trust in America's Health, or TIFA, is a public health policy, research, and advocacy organization dedicated to optimal health for every person and community. We produce several reports annually, including our 2025 State of Obesity Report, which is the most recent one, published back in September. And we also publish periodic briefs related to our age-friendly public health system work. The most recent one that we published a couple of months ago was on the public health's roles in supporting family caregivers. And you can access that brief on the AFPHS website as well. So next slide, and we'll get a chance to introduce and hear from our speaker today. We're so excited to be joined by Robbin Frazier, Assistant Director of Dissemination for Dementia Caregiving Programming in the Center for Healthy Aging and Innovation at the University of Minnesota. Dr. Frazier is going to provide an overview of ALTER, a program dedicated to creating dementia-friendly faith spaces within African American congregations. And she will also share how age-friendly congregations intersect with public health and other sectors in the age-friendly ecosystem. So, Dr. Frazier, thank you so much for being here, and we welcome you to go ahead and get started.
All right. So happy to be with you here today. And so I am a part of the Alter team, and Alter was founded by Dr. Ron Epps, and I'm a part of her team. And specifically, I lead the Minnesota congregations that we've recruited for here. And I also help Dr. Epps with training, and we're working with public health agencies and others. So got a couple different hats, but just so glad to do this work because I just so much believe in the power of us working with our different spiritual communities. Next slide, please. Okay. And so when we think about altar and why we exist, it really is to equip and support our faith communities so that they can be there to help both individuals that are impacted by Alzheimer's and other forms of dementia, and to be there to support the families, those caregivers and care partners. And so our goal is that churches are a dementia-friendly and age-friendly place for people to age well and have the support that they need. Next slide, please. And so I wanted to just give some background around Alter. Alter is a program that was developed by African American professionals across different disciplines, researchers and nurses and others. And the reason that there was a focus on the Black community are some of the key points that we've highlighted here. Often people in the community don't know that African Americans are twice as likely to develop Alzheimer's or another form of dementia. And so the Black community is a at-risk community for developing one form of dementia or another. And we know that with the changing demographics, that by 2030, 40% of all Americans living with Alzheimer's will be Black or Latino. And so this really is a high priority area for public health as we look at our aging population and the diversity of those populations. The research has also shared with us that we know African Americans are less likely to get a formal diagnosis around the type of dementia that they have, or even just the diagnosis of dementia. And there are concerns from the community. 48% of the people are not confident that they're going to be able to access care that is going to be culturally competent and responsive to their needs. And we know that half of the people in the African American communities that we've done the research with have experienced discrimination. So when you combine those things together, this is why Dr. Epps and the team focused in on the Black community and launching Alter there. Next slide, please. And so, as they looked at the Black community, what they had to think about is, who does the Black community trust? We know that in some cases, people's lived experiences and also just their knowledge of historically what has happened with the Black community in terms of the medical oversights and experiences and lack of care, it makes them concerned about talking with people, feeling like they're going to be listened and that they're going to be responded to. And so, as we thought about where do people go when they need information? Where do they go when they're caring for a loved one and they're going to need that spiritual support, or they're looking for a referral to a trusted place? And so the Alter program was built and designed around partnering with predominantly African American churches. And the reason that the church is a fit is just, first of all, just being a safe haven for people where they feel like this is their second family. The church is often the second home for the people there. It's also a place where they feel the church is going to vet anybody speaking to them, or they're going to hear directly from people that they trust and that the information will be accurate and relevant for them. And as we look at the church, it has both the social and the spiritual connectedness. And that is so important as we look at Alzheimer's disease and related dementias, because if the church is dementia friendly, if they have resources there, if their people are informed to help those living with the disease or supporting others, then you're going to have the power of that church to help reduce isolation and loneliness that is often associated with this disease. There is still a lot of stigma around this disease where sometimes people feel, like it's a mental health issue, or they feel that it's linked with something that may be a taboo subject, those types of things. And so people are hesitant to explore and talk about this because they're worried how other people are going to treat them. And with the church, the nice thing about partnering with them is that they are in the community and of the community. And so that means that they're going to have that knowledge of the congregation that they serve, that trusting relationship with them. And so with the churches, what you're able to do is to do an intervention like altar, because you can help create that environment where they trust that the program has developed for them. It's not an afterthought, but was designed by people like them for them. And that's very powerful as we go out and talk about altar. Next slide, please. And so the origins of Alter, I'm just going to spend a minute on this because we've covered some, but Alter it launched in 2019. And it feels like it's been here forever. And I know I've been involved 3.5 years, but it always feels longer. And so whenever I see the slide for 2019, I'm like, or 2019, I'm like, boy, it just seems like it's been here longer. And so where Alter evolved from is that Dr. Epps was at that time at Emory University and also working at Georgia State University. And she was closely affiliated with the Alzheimer's Association, I think on their board, but doing a lot of faith-based outreach and dementia education. And so they started seeing more and more requests about Alter and people wanting to learn about it. And so that's where it started. And what soon happened, about a year down the line, is the pastors were coming back to Dr. Epps and they said the education was great. So people have recognized the symptoms, they've connected with the provider. We've got people diagnosed with a form of dementia, and we've got people that realize they're going to need to have an increasing role in helping their loved one. So they said, so what comes next? What program is next? And Dr. Epps and the team were like, oh, we started with this education because there had been a lack of that in the Black community, less education there than other communities. And so they were like, okay, what are we hearing? And so they spoke with those congregations and they heard that they needed resources, they need support for their caregivers, access to programs that can help them, and just ways to take action within the church. And so Alter was rooted in the community stepping forward, saying, now that we have the education, we understand how we are impacted. How are you going to help us? Next slide, please. And so in the present day, the work of Alter has just grown much larger than what was initially imagined. Alter started based as a program being launched in Georgia. And they had hoped to have Alter, over a course of 5 years had the program in maybe 20, 25 communities. That's what it started with. Well, now Alter is in many, many states, and we'll talk about that. But there has been such a warm reception to Alter as people are learning and understanding more what the impact is on people living with dementia and the impact on caregivers, and also the length of time that people live with this disease. And so it's one where, the loss can be over a long time as people have less ability to communicate. They don't have as many of the things that they used to do that they can do. They may need assistance with that for a while. And then later in the latter stages, there's going to be things where they're going to need help, often around the clock. And so the Alter program is growing rapidly, and it is because the churches see this as a part of their role, and it's a role that they've always played in helping to take care of their congregations. Next slide, please. And so this is the Alter team. Um, uh, it has our different team members. Dr. Epps doesn't have herself on here, but she was, I think, on one of the earlier slides. And so you'll see me there as the Minnesota site coordinator. We also have site coordinators in Mississippi and in Virginia. And we are bringing on people in Texas and Pittsburgh and Louisiana. And so the Alter program is growing in terms of people within a state that are the lead in that geographic area for the programming, doing that outreach and recruitment. Next slide, please. And so, what happens when someone wants to partner with the Alter program? And so, what we ask is if there is a faith community, or it may be a larger group. It sometimes is like a district of within a specific denomination. Sometimes it's others that want to promote Alter. But what the churches do with Alter is they make a 2-year commitment, and they agree to do initiatives in 3 areas: education, support, and worship. And when I was asked by Dr. Gogler here at the University of Minnesota, did we need the Alter program? He says, Robbin, I worked at the Alzheimer's Association 5 years prior coming to the university. And he says, I know that we have so much work going on at the state level. We've got many of our aging service providers. Do we need Alter? And when I took a look at the program, I said, yes, we do. I said, Alter is going to give a framework where people are going to be able to have greater reach and greater impact in supporting the community. And that's because we had some church congregations that were doing all education. Other ones have support groups, but they were only working with the people in the support group, but not doing education. to members that they didn't know that could be affected. And so what I love with Alter is that it is a framework that makes sure you're going to cover those three pillars, but there is lots of flexibility in the initiatives that you can do. And so the congregations that sign up for Alter, they agree to do 8 initiatives that are the core required initiatives. And those are around the name tags, lighting, having a quiet room, making sure people your greeters and your ushers are able to help people. So it's kind of that physical environment piece of it. So the environment can be age friendly and dementia friendly, but then they pick another 8 initiatives across those pillar areas. And so we will talk about those a little bit here. And so it's a 2-year commitment. It is not a legal contract. Dr. Epps and the team, they call it a memorandum of understanding. So it's everybody going in with the good faith intent that over the 2-year period, they will do these initiatives across the different areas. And the congregation, they get an opportunity to change those initiatives. And so if they start, for example, attending a support group of another organization, they may determine, as they know more families that are affected, they may say, we want to lead our own support group. Or vice versa could happen. And so you select those initiatives, but then you're meeting with site coordinators like myself, and we're able to adjust that plan and make sure that it is meeting the needs of that church and congregation where they are at. And so each church is doing what they have done and assessed with their members as most important. We also have a biannual meet and greet that we do where you're able to learn from people launching Alter in everything from major cities to very rural areas where there are limited providers and hospitals and maybe even limited aging service providers to partner with. But we get everybody together that twice a year so that we're all up to date on Alter and all of the new research and innovations that are going on to it. We do ask that the people that join the Alter program that they just keep track of their events that they hold. And when they do their evaluation, we'll ask them, how many families did you work with? How many people living with dementia? What types of activities that you do? And they do this all online. And then site coordinators like myself, I'm able to see that for the 8 churches here. And then other site coordinators are able to look at that. But it's still a program that is always going to be a living, breathing program and responding to the needs of the community. So we want to have that ongoing relationship. And at the end of the 2-year period, some churches, like here in Minnesota, 6 of my churches decided they wanted to do a 3rd year because it took a while in the beginning to get the volunteers, and they found they wanted to do a lot of education. And so that's where they started. Now they want to do some programming, and some of them that are geographically close or of the same denomination, they want to partner on some things. So they said, we're going to do another year active in the program, which means they're doing those 8 initiatives that they select before they go into legacy status. But if the Church is in agreement, and they continue to be invited and able to partake in altar trainings and programs and scholarships, those types of things that are available. And so that helps with the sustainability of it. Next slide. And so these are the pillars that I spoke to earlier. And underneath each pillar, you'll see there's an example of the types of activities that could be underneath there. Like under education, a very popular one is doing either Memory Sunday or Purple Sunday. So either with the Balm and Gilead or with the Alzheimer's Association. We just had a large Purple Sunday event, and everybody had on purple, and they had resources and speakers, but they dedicated their whole worship service was focused in on the caregivers and people and the music that the elders would relate to. And so this is a list that we provide, and they get a community guide as a part of their toolbox when they join Altar. And so each one of these activities is described in there step by step, like what's the intent, how much time do you need, what kind of resources do you need, and so they don't start with a blank sheet. We learn and see people do these, and we add them there, so they're able to go to that booklet and see what things they want to do in that area. The other area is the support area there. And we're seeing more churches look at respite programs, short duration. Sometimes that could be a 2 or 4 hour program. It might be once a month. It might be once a week. It really depends upon what the needs and resources are there. And they're doing memory cafes where they're bringing together both the care giver and the care recipient, where there may be a social activity that they're doing. It can be going to something out in nature, whatever they would like to do. And then they can determine what they want to do in the worship area. One of the things that can be a challenge as you work with the churches and we talk about what is working in terms of how long can people be in a church service, those types of things. That's where, like the church that just had the Purple Sunday, they reduced the time. Normally it's 2 hours, but they strove for an hour and everything was done in an hour and 15 minutes. And some of them will break up their programming too, so that you don't start with announcements and upcoming activities. You're starting with that praise and worship. So if someone can only be there for part of the time, they're there in the beginning and then they can go to a quiet room or, they may set a time to be there. And so with the Altar Toolkit, there'll be information on all of these programs that describe it and resources. And then what each state does is they put together a list of aging service providers in their area that have programs in this. So for us here in Minnesota, we are just very blessed. Our list that we share with our churches when they're joining Altar, it is 4 pages of resources. And it's state resources, sometimes it's county, it's community-based organization, it's aging service providers. And so we just put them in the categories of who all does education and what kind of education that they do, who can help with support. And the worship tends to be more internal unless there's something denominational that is going on. But people, as they are onboarded, they have this information there. And that is because we do not expect them to be dementia experts. I tell them that my role at the university is to connect with community, and my role in Alter is to connect faith communities so that they are inspired and they are equipped to support their congregations. And so that's what we do and help people get started with this. Next slide, please. And so these are the services that we offer in Alter. And the first one, if we'll go to the next slide, I'm just going to spend very brief time on these, Karen. And so one of the things that is mandatory for every new faith partner is that they must attend our dementia-friendly workshop for congregations. It is a 4-hour training where they get a binder and they learn about the disease. They learn that dementia is not a diagnosis. And why you would want to pursue a diagnosis. They learn how to support loved ones, communications. They learn about resources, all of those things. And so we ask that each church have 2 altar ambassadors because, things just happen in life at the age that most people are that are doing this programming. And so if you can have 2 people that lead it, and then they recruit 2 to 3 volunteers, it helps you have the resources within the congregation to do that. And then we also twice a year have ongoing trainings that are around understanding dementia, and it'll be various experts that could speak to, for example, the risk factors around cardiovascular. It could be someone that's talking about the importance of sleep and how that impacts brain health and heart health. So with Alter, what I love about launching it is when you launch this program, it is not a stagnant program. Like this is the program A to Z, do that. There is constant innovation that is done with the program, and you don't have to do it. You just have to disseminate it and get it out to the churches so that they can use that. An example is Dr. Epps partnered with Us Against Alzheimer's, and they developed, they called it the Faith in Action Toolkit. And it allowed them, the church, to have a zip drive. They could present on brain health. It gave them all of the information that they needed on it so that when they find appropriate on Sunday, it could be on a weekend, they have that. And they received $1,000 to do that. And so we try to give every church a stipend. It depends upon who's funding it. And that stipend is one time for the 2-year period. But then as Dr. Epps and the national teams partners with others, they bring forth opportunities. And so then the churches, they get to decide yes or no. And if they want to do that. And, we try to make sure that there is some funding for them to implement that activity. So education is always ongoing. And next slide. We've already talked about the toolbox, but imagine a box about twice the size of a shoebox, and it is filled with information, booklets, your binders, everything that you need to have that baseline information around it. And it includes a lot of information that you can use in working with and supporting caregivers. And so after they do that initial training, then they received that personalized box. And there'll always be things specific to their community and state that are there for them so that they know the local resources. Next slide. We have ongoing consultation with the congregations that sign up. Everybody, I have all of my churches are here in my phone, and I've got the ambassadors' names are in there, and they have mine. They have Dr. Epps. You are going to reach somebody, and I'm just available when they need me, and it does include some night and weekend work. But if you're going to do this program, you're going to want to have people that um, are either have the skills to be in the community or they're willing to develop those skills to be in community. And so I'll be there the first Purple Sunday, the time they do it. Then the next time, they may need some resources and I give them some referrals, but then they're able to do the program because we want the capacity built in community. And as you can see, all of us have been so impacted by federal funding. I'm 80% federal funding, so I'm on my third notice that my job will shrink down to 37%. I just keep doing the work and we'll see what gets funded, what gets renewed. But you really, with this program, the church is building that muscle and skill set. And so it should be work and where they have the relationships and connections that they can then continue that work after those initial times. Next slide, please. We do, as they become a certified partner, I've already mentioned that opens up them like receiving a discount to the annual summit, and scholarship opportunities, also professional development opportunities, like the site coordinators this summer. We were just notified this week that we will be able to have an intensive training around the memory cafes so that we can train the churches on the memory cafes and then they can train people on this. So it's continual opportunity for development there is a part of this. And there's also newsletters and, ongoing research opportunities that are shared. Next slide. And we've talked about this, so I'm going to go to the next slide here after that. And so this shows the original goal of the Alter program back when they launched in 2019. The goal, one state, it was a Georgia program. 7,500 participants and 24 churches was the initial goal. Where Alter is today is we're actually, I think, bringing on the 24th state. So this is within that 5-year window. Over 21 states are have Alter programs in them. Over 100,000 people have been reached. And in terms of program partners, it's over 112 different organizations are participating. And here in Minnesota, there are individual churches right now participating, but in other cases, it may be that it is a church district that is made up of 6 churches or 12 churches, or some organizational partners that are going to support Alter across there. So there's actually, many more sites that are involved with it. Okay, and somebody watch the Q&A. I'm gonna wrap this up so we can do that question and answering because I want to be able to ask that. And next slide. So this one just shows the partnerships across the 23 states. If your state does not have an altar program, know that the altar team is open to conversations with you about that. And who altar partners with in a state, it can vary. In our case, my work is funded from our geriatric workforce enhancement program. So that grant funds Alter and other initiatives that are working to educate student, faculty, practitioners, but also community. Sometimes the funding may be with a specific program. We have many public health departments. I think we have at least three now where the public health department, they are the ones that launched the Alter program, and they included in and talk about dementia and dementia education when they are out talking about chronic diseases and obesity and smoking cessation. So it can really be a variety of organizations within the state. And if you go to the alterdementia.com, that is where you can fill out information and we can connect with you on that. And let me say that for the alter programming, um, it involves people from the aging ecosystem. And so those people that provide direct services, they are involved there. It also includes us working with our departments of human services, the departments of public health in those, because they may have programs that are in the church or they may decide to launch Alter. And for the first time, we are working with a new grant with some non-traditional partners that aren't a public health agency or a university. One is a nonprofit specifically focused on dementia in the Black community. One is a hospice and palliative care organization. And so that has been really interesting. And we were just out in Boston and met with them. So we had the Alzheimer's Association, we had the hospice group, we had a representative from their local state agencies. And so the people are collaborating and communicating because I mean, all of our churches here, when they started the Altar program, they had existing relationships, just about all of them, I would say. 4 out of 6 had existing relationships, but it might have been for education only or a support group, or they do the Alzheimer's walk, that type of thing. But one thing you want to do is I am always I tell people before I go to a church, I prepare like I'm going to a job interview and I look at everything available because you can learn if there's a senior ministry, a women's ministry. So many of the churches have a health and wellness ministry. And what we encourage them to do, because the ministry leaders already have a lot of responsibility, is to have an altar team with volunteers from different places because you're going to want to make sure people are greeted. You're going to want to make sure that the ushers can support someone that may just want to pace and walk or do that. And so we try to get them to have that team of volunteers from different ministries and areas and have found that to be very successful. Okay, and we've got just a couple slides, and what I'm going to do, Karen, is only just probably pick 2 more slides to talk about. If you can just forward, I'm going to let you know because I know we need to get to Q&A. And so with the Alter program, the process is they complete an application. that application is reviewed. If the team feels like they're ready, then they will go through onboarding, and then we'll be supporting and working with them for the launch for Alter. But all of that process is laid out for them. And what the team is doing is there is such fast growth. In the old days, I could just call up Dr. Ipps and says, Dr. Ipps, this pastor is available. Can we do an informational meeting? And so now with the growth, there are scheduled times on when are there informational sessions every month, Thursday, and when are their orientation and when are their onboarding. So the team has been continuing to expand that infrastructure, because when people learn about the program, they're like, okay, let's get going. But there's steps that they need to follow to, have the background and things that they need. But we have all of this well laid out for them. And next slide, Erin. I just want to say on this one, I know that one of the areas of focus for you is understanding and talking about the aging ecosystem. And like, does Alter fit in with that? How does that work? Very much a part of it. And so we put out a opportunity for all of our ambassadors to become dementia friends. And our goal was 100%. I think we got to 80. And then out of that group, 5 of them went on to be Dementia Friends champions. So that's what they did last year. Then this year, the goal is that they will do the Dementia Friends training within their church once or twice. And then if there's another sister or brother church, that they will do it then. And so we make sure that we are sharing information on what's going on across the ecosystem. So here in Minnesota, we have the state Alzheimer's and Dementia a plan that is led by our Department of Health that has lots of different committees and things that you are integrated in. We have Age Friendly Minnesota, and they do grants, community-based grants. We have Dementia Friends Minnesota, and we've had a long history here of organizations, community-based organizations, receiving funds to do dementia awareness, education, and those things. And so we make sure, and now we have the focus with reframe aging, because so many of the elders, they're like, I get cut off by my hair color. The ageism is so strong. And like our cab has identified children's book. They said we need to start with the kids because the kids are already treating us, like we are disposable or our usefulness is gone. And with everything going in the world, you need every generation, every family member, that type of thing. And so know that with Alter, people are aware of these. We had 2 people for the first time that put in applications and joined our Minnesota Board of Aging. And that's something somebody would have never done, but they stepped up into a leadership role within their church, and now they're stepping into other statewide activities. And so we keep people and let them know. I've got 2 people that wrote me about a new grant that came out, and I don't think they're quite ready for them, but if they partner, they might be. But I mean, they're on it. The pastor sent it, said there's a Alzheimer's awareness grant, and it can be up to 40,000. Call Robbin and ask her about this. So know that they on their own are applying for addition funds too. So we make sure that's well known. And if you can just look, Karen, just if there's anything else. I'll mention that this is a QR code if you want to capture it. Otherwise, you've got the website that people that are interested in becoming a dementia-friendly faith partner with Alter, that they can do that. Right now, this program is specifically tailored to the African American community, but we have also developed and worked on a toolkit that could go across to other communities, and there are people interested in the Somali community, the Hmong community, the Jewish community. So I see Alter as it grows and you bring in those researchers and community members, the name might change. It might have to be specific to that culture or religion, but it is definitely one where there's a lot of interest, but still we're in year 6. But there's definitely growth intentions there to expand the program. But you have to have the researchers and you have to have the community because it is grounded upon knowing that community. All right. And you know what I'm going to do, Karen, is I want to stop and just see what questions people have. And then I have the presentation in front of me on my screen. So I'm just going to see.
Yeah, so Robin, I've captured some of those questions.
Oh, great.
I'm going to ask the last one first because I think a lot of people might be interested. So
Okay.
the question is, can you provide contact information if someone was interested in starting a group? Can they just go to the Alter Dementia website and
Yes.
do that? Okay,
Yes,
so
that's what you
that one's
do. If
answered.
you go to alterdementia.com, you can express interest if there is a congregation that is interested, or if you are a part of a public health organization, or it could be a nonprofit organization that wants to learn more about Alter. Please go to that and you'll be able to have that.
Great, thank you so much. And then another question is Alter working with local health departments to provide awareness, education, and health promotion? And if yes, how?
What happens with in terms of working with the local groups is I shared with you that we've got a 4-page document of local resources. And so I think just about all of our churches are at least once or twice a year, they are having their health fair. And so what they do is they know of these organizations because we brought them in and connect them. And so what they are able to do is they invite them there. Like, for example, we have a group here that is Volunteers of America that has culturally specific and responsive programs. So they have an African American community health worker, 2 social workers, they have the nurse, they do virtual and online meetings. They will go to the doctor with the family. So all of our churches, they know of that organization. They know of all of our area agencies on aging. All of them will help them become a dementia friend and do initiatives there. And so what they do is they invite these organizations in to participate and deliver programs. And so that is part of why it's so important in terms of my role. We don't deliver programming. Our role is to connect people in the community and be that bridge so that they know who they can contact and who can come to their church or, their meetings with it.
Yeah,
And the other piece is that the churches, as they have learned more and more around Alzheimer's and dementia, and the more they learn around the risk factors for it, they want those risk factors addressed. And so the
mhm,
churches are not only focused in on brain health, they're understanding that intersectionality with heart health. And some of them just, one lady, I went and met with them, and she said, we already got people on diabetes and cholesterol and that. And her eyes just welled up with tears. She goes, now you're saying we're twice as likely to have this too. And it was just like, why all this bad stuff? And what I explained to her is that yes, we have these different chronic diseases, but I said when we look at what are the actions that people can do, I said there's some things we can't change, but we have research telling us that we can reduce the risk of developing Alzheimer's and other forms of dementia through some of the things that are within our control. Of course, it depends on resources and accesses. If there's no grocery store, there's no grocery store. If there's no medical,
Mm-hmm.
it's not there.
Yeah.
If the care is poor at the hospital. So we always talk about the social determinants of health because people don't choose to have poor health. They don't intend to get a disease, but we let them know about that. And so they are bringing in lots of the programming on sleep, a whole sessions on, they've got blood pressure cuffs. They take blood pressures every week at church. So you raise that awareness of what are things that make you more likely to develop some of these chronic diseases. So to help them manage that, but then understanding their linkages with brain and heart health. So that's where I tell her it may seem like a lot of different illnesses and things, but we can get it down to even using as a baseline the Alzheimer's 10 ways to love your brain, because everything on the 10 ways is good for your brain, it's good for your heart. It will help you avoid some things, or the things on there will help you manage something if you've got like type 2 diabetes, those types of things. So that's where you have to have those conversations. And she's like, okay, so it's not like we got a million things. I said, no, ma'am, we're going to help you link them together and understand those and then do the programming where you have those concerns.
No, I love the connectedness and
Yes,
the alignment, the intersectionality that you mentioned. That's so important to really
yeah.
making sure that we're addressing all the needs of people and communities. So we are
Mhm.
getting to the end of our time. Robin, thank you so much for
Okay.
sharing this wonderful program with us. It's
Yeah.
generated a lot of interest, and I know that folks are going to be reaching out and checking out that website. So we really, really appreciate everything that you and Dr. Epps are doing. I did notice that Paulita
Yes,
Edward
Miss
Childs
Paulita,
is
she's a
here.
champion.
I just wanted to see if Paulita wanted to say a couple words in the last minute or so.
Hello.
There she is.
You did a great job, Robin. She's explained it very well about the Alta program. She's the number one champion, not me.
Oh, if it's one, it's 1A and 1B. The Miss Paula brings it. She brings it because I'm on 5 grants. She gets to do this as core to who she is. And the one thing slide that I didn't get to is there are underneath the GWEP. So we got through all of the altar piece, but our geriatric workforce enhancement program, you're going to see this in there. There is a linkage to the summary for the altar toolkit, but then the general faith-based toolkit is in there, and the dementia caregiving, that what I want to call it, a group that we're in, it is a wealth of resources. So I gave
Yeah,
that to
they're great.
Karen for that, but that is one thing that we weren't able to pull up, but it tells you why the church is, even more than what I can cover, but why they are a fit, how you prepare to see them, how do you do that assessment, what types of questions do you ask? Because you want to be humble and not make a lot of assumptions. And you always have to position altar as it is complementary. And
Right.
before I
Right.
even met with the church, I met with all of the aging service providers I knew. and people that I knew were working with the church, because as soon as the church is here, everybody's like, well, I've been working with Miss Velma for 10 years now. She helped me through my, it's like, you gonna keep on working with Miss Velma? Look, there's Miss Velma right on my list. So you want to make sure that they know that all of the existing relationships that they have, Alter does not disrupt that.
Yeah,
Those people are going to continue to support them, and
absolutely.
people are
Yeah.
seeing more demand for their services. Because when the
That
churches
is what's
do the
important. Of course,
initiative,
building that
yes,
trust relationship is really the most important thing. Well, we have come to the end of our hour. Thank you
yeah,
again so much for everything you're doing. Karan, I'm
thank
going to turn this
you.
over to you to wrap us up.
Thank you so much, Robin. I'm glad that you shared all these resources and we get to share them. So there are still additional slides. I know there was questions about public health and your sections. It's there's going to be a wealth of attachments and resources shared with the recording. So those of you on the call and those of you that registered can get access to that information when we send it out next week. So thank you so much, Robin. I
Yes.
enjoyed hearing some of the things I said, yeah, that is true in my own past engagement with churches. So to close us all out for our last training of 2025, just want to remind you all that we will see you back here January 2026, January 15th to be specific, excuse me, at 3 p.m. You can register for this under our website. And we want to make sure that we re-emphasize and highlight that we have a new survey for tracking your attendance at our trainings. So please pause now, or if you're here live, use the information on the screen, QR code, the website, to indicate that you have attended this training. Again, this is a brand new link. The old link will not work. So if you are here, make sure that you note this new survey. We will use this moving forward. We will not be going back to the older link. I'm going to pause for just another moment or two to make sure that everyone that wants to capture it can. And thank you all so much for attending today.
All right. And Karen, I'm happy if you want to email me questions to share my email address, and I can follow up with anybody.
Sounds good. Thank you so
Yes.
much.